way they used to do it in British TV, they would say everybody's safe.
For 7 days that we were in Gaza, we saw every day people suffering because of a lack of food. There's not enough food. What is available is too expensive for most families to afford, and the kinds of food that is available doesn't cover all of their dietary needs. There's at least half the population of Gaza today in emergency levels of food insecurity. So we know people's health is deteriorating, their families' health, their children's health, and we're extremely worried for all of the people in Gaza today. Right now, it's a kinetic war zone. It's very difficult to coordinate and negotiate access through checkpoints into areas where fighting continues, but where we know there are civilians living. We know there's at least 300,000 people in Gaza City in the north of the Strip. We've got to get to them. That's the area where there is the most acute levels of food insecurity. But to do that, we have to go through a lot of discussion, a lot of negotiation, but also just the physical constraints. There's rubble everywhere, there's unexploded ordnance, there's fighting continuing, but there's also a massive vacuum when it comes to law and order. There is so much congestion, there are so many people. Just getting trucks through areas into other areas is nigh on impossible without leaving extremely early in the morning, but also spending a lot of time to negotiate their safe delivery, their safe access. The integrated phase classification, which is a survey of food insecurity that is done globally, was completed, the last one, in December of last year. That told us that unless we get significant volumes on a regular basis to people in the most food insecure areas of Gaza, that we would have famine conditions in place by May or June of this year. We are not getting significant amounts of aid in. We are not doing it every day as we need to do. We need at least 30 trucks every single day going into Gaza City, and we may get 8, 9 or 10 once a week, every 2 weeks. That's not enough to prevent famine. We need action today. We need the pause to take place as soon as possible and to come into being so that we can get food and other important aid, clean water, hygiene materials, sanitation materials, shelter materials to people who are suffering today because of a complete lack of all of those items that are needed to essentially give people a life, an existence that they are so desperately needing right now in this situation.